I'm Elaine Branjord, a member of the Colorado Foundation for Universal Healthcare Board, and it is my pleasure to introduce Rose Roach today. And we are very fortunate to have her speak to us because labor is a demographic that we really have to address in all the work we do trying to get support for universal health care. And Rose has lots of experience. Rose Roach is the executive director of the Minnesota Nurses Association. Go Nurses. Oh, retired. I don't want to give her more work. And she's had 30 plus years of experience in the labor movement in Minnesota and California. She is also a member of the Healthcare for All Minnesota Board of Directors and sits on the National Steering Committee for the Labor Campaign for Single Payer, which is a great organization that we can refer and use materials from there. A Minnesota native, Ms. Roach spent 11 years from 2003 to 2014 working for the California School Employees Association and was active leader within the California healthcare policy reform movement. She's a passionate advocate for healthcare justice, and she's a national speaker on healthcare reform, specifically via single-payer, improved and expanded Medicare for All system. She has been recognized as one of Minnesota's 100 influential leaders in healthcare in 2016 and again in 2020. Ms. Roach served on former Governor Dayton's Healthcare Financing Task Force and is co-chair of the St. Paul City Task Force on earned, safe, and sick time. Ms. Roach was also a member of Minnesota Attorney General Keith Ellison's Lowering Pharmaceutical Drug Prices Task Force, whose final report won National Notable Document Award from the National Conference of State Legislatures. And we welcome you today.
Well, good morning, everyone here in Colorado, and greetings of health and solidarity from the Labor Campaign for Single Payer and also for Healthcare for All Minnesota, but also deep, deep sadness and horror as I woke up this morning to the news of the targeted political assassination of the Speaker Emeritus and her husband, Melissa Hortman, and then also of the attempted assassination of Senator Hoffman and his wife, a friend and a kindergarten teacher who apparently laid on top of their daughter in order to protect her and save her from being shot as well. They're saying that there were two men that came to the door at 2 a.m. dressed as police officers and targeted politically these individuals. We're also hearing that they're considering canceling events around the No Kings today because they found literature in the vehicle of one that spoke to how there will be more targeted attempts today on people's lives. I worked closely with both of those legislators during my time at the Minnesota Nurses Association, and I'm still processing this really horrible act of political violence. So I would just ask you to kind of bear with me here as I get through the presentation. I want to dedicate my presentation, though, to Speaker Hortman, her husband, Senator Hoffman, and his wife, Yvette. May they successfully recover from these horrific injuries. I'm going to talk kind of fast this morning because I want to get a lot of stuff in. Don't worry, you're going to get copies of the slides and my notes, so you will be able to refer to them later. And I'm going to treat you all as if you are trade unionists today, because this is all about figuring out how do we sell this, right, to union members, but also to workers in general. You don't have to be in organized labor to be a worker that needs to get on board with the fact that we can no longer tie health care benefits and our access to health care to our employment, right? Doesn't make any sense at all. I often say that healthcare is the section of intersectionality, is the issue, of intersectionality across the entire justice movement. And as healthcare costs continue to rise, rising costs continue to divide workers. And the corporatization of healthcare is at the heart of both, and it continues to run rampant. As this scenario plays out over and over again, the labor campaign for single payer feels a real urgency to saving and protecting Medicare, as well as all public health programs, while creating the conditions necessary to build the pathway towards a public health infrastructure that will be ready to handle us all under an improved Medicare for All system. That urgency has the labor campaign calling the question, is healthcare a negotiable benefit or is it a human necessity? And if it's a human necessity, then it's time to prioritize and resource the campaign to win it and take healthcare off the bargaining table. So what do our current headlines tell us about this system that exists at the moment? Just take a look at these, right? Health insurers have spent over $141 billion buying back their own shares since 2007, while premiums and deductibles have skyrocketed. For private equity firms, dropping ER docs is a simple equation. Insurers pocketed $50 billion from Medicare for diseases no doctor treated. United Healthcare, in my backyard, caught paying off nursing homes to let seniors die because hospital transfers were too expensive. You can hit the button one more time. And then there's this headline that really does say it all, doesn't it? Goldman Sachs Asset Biotech Research Report, is curing patients a sustainable model? There you have it. The focus on our system for the last half a century, and this has been bipartisan, this is by no means just one side, it's been bipartisan, has been on incremental market-driven tweaks that have failed miserably, yet these failed strategies continue to dominate the healthcare reform debate. These market-driven reforms are known to us as managed care. By the way, they do not manage our care, they manage money, and our care is managed by our care providers. Many health economists in this country hold to the idea that excessive healthcare costs in the U.S. are due to two things: physician greed and patients getting too much care. Neither of those two diagnoses are correct, and there isn't any evidence saying otherwise. Evidence actually does show that managed care schemes have increased costs, done little to improve quality, and have exacerbated health disparities while driving extreme market consolidation. You can't use market forces to control healthcare prices because healthcare isn't a consumable good. It doesn't work that way. So what is driving costs? To quote the late Huey Reinhardt, Princeton economics professor, it's the prices, stupid. That's literally an article he wrote. Google it. Next one. The impact of corporate privatization of healthcare has brought us these industry trends in healthcare, and these trends take us further away from what's in the best interest of the patient and provider, with schemes such as hospital at home, also known by the nurses as home all alone, aimed at keeping patients needing acute care out of the hospital. Instead of admitting these patients who would otherwise be traditionally hospitalized, they're sent home with an iPad and a smartwatch to be admitted for hospital care at their home. AI and algorithms. Private Advantage plans are at the tip of the AI algorithm iceberg, using artificial intelligence to systematically deny skilled nursing care to elderly patients with serious health problems, according to senior advocates across the nation who are engaged in class action lawsuits on this very issue. Lean management comes out of the auto industry. It's basically doing more with less. You can't run a healthcare system on this model and prioritize patient and provider safety. It simply doesn't work. And consolidations and mergers. None of this is good for healthcare workers either. Go ahead. This is what consolidation looks like, thanks to managed care ideology. Contrary to the industry claims, consolidation and merger frenzy within healthcare almost always increases costs. It doesn't decrease it. This graphic gives you a sense of how convoluted on the one hand, and yet how incredibly concentrated on the other hand the U.S. healthcare marketplace is. 7 large corporations pretty much control all aspects of healthcare except, of course, for actually providing care. That market consolidation is raising prices while also causing healthcare deserts, because healthcare corporations are making decisions about where to open or close healthcare facilities based on their bottom line, not the community's healthcare needs. Rural healthcare is particularly affected by healthcare corporatization and merger mania, as we see continued closures of rural hospitals and reduced services. We must get back to hospitals serving as true community assets. Next one. One area the labor campaign is working hard to fight against is Medicare privatization. The privatization of Medicare is probably the most obvious and egregious of the privatization efforts. When I talk about the privatization of Medicare, I make sure to note 2 things. First, I'm not sharing this information to shame or blame anyone. It's understandable why many retirees choose a Medicare Advantage plan instead of traditional Medicare with a Medigap or supplemental plan, because I'm one of them, we're on a fixed income, and we have to do what's affordable for us. And that's the same for unions and employers as well. There's only so much money. And we all know that healthcare is expensive, and nothing is being done to actually control the cost of healthcare. Same is true, as I said, with unions who have negotiated Medicare Advantage plans for their retirees and employers who have moved their retiree health benefits to be offered through an Advantage plan. It's about affordability as it relates to the high cost of healthcare in general, but it's also really important for retirees and unions to know that Medicare Advantage is not Medicare. Advantage is the misleading name given to the privatized portion of Medicare, the portion in which tax dollars are funneled through private insurance companies. I also think it's important to note again that the privatization of Medicare and all of our public health programs is actually been done on a bipartisan effort. That's why, regardless of political party or ideology, when it comes to healthcare, it's in all of our best interests to work together to protect and advance public health. Next slide. Now we've seen, you can hit the button a couple times because it'll bring up there you go. We have seen many statements like this, one from Kaiser and others, consistently describing the failure of corporate advantage plans to save money, and in fact they are only increasing the cost of health care within Medicare. Next slide. Problem is, through the Medicare Trust Fund, we are actually subsidizing these private insurers as much as $140 billion a year. We're already spending that money on healthcare, it's just not going to healthcare. Okay? They're gaming the system. Recently, the Committee for a Responsible Federal Budget has determined that Advantage plans will be overpaid by $1.2 trillion between now and 2034. $1.2 trillion. Next slide. Within corporate Advantage plans, death rates double after some cancer surgeries. 7.3 million people are left underinsured in Advantage plans, and up to 20 million hours per year are wasted because care providers have to fight with insurance companies to get you the care that they, the professional, has determined you need. This is all interconnected in a way that seriously harms patients. So what does all this corporate privatization of healthcare mean from a labor or a worker perspective? We'll go to the next slide. I want to begin to address that question by looking at this activity from the labor campaign's training. Oddly enough, it's called Runaway Inequality and the Crisis of U.S. Healthcare. How has the negotiation of healthcare access, i.e. health insurance, actually impacted workers in this country? So you can see a couple of questions there. Do you think your union bargaining committee has been forced to make trade-offs between wages increases and healthcare costs? I've never had anybody in the audience say no to that, right, ever. You know, have your co-pays, deductibles, and other out-of-pocket costs increase? Again, of course they have, right? Have you taken or stayed in a job because of the healthcare benefits? That also is very, very unfortunately true. When approaching unions about joining your state health justice campaign, consider how you might incorporate these questions into your work with them. They really highlight what labor has been dealing with and helps trade unionists put into perspective what we've been sacrificing in treating healthcare as a negotiable benefit versus a right for all of us, because quite frankly, it's a need for all of us. Next slide. It's critically important to recognize the fact that there is no question that unions have in fact helped to shield working families from the efforts of corporations to dump healthcare costs onto the backs of individual workers. Most union members have better healthcare benefits than non-unionized workers. However, it does come at a cost. They may be excellent plans, but you have to buy separate insurance for your teeth and your eyes, right? How insane is that? They happen to be part of your health. And more employers are moving away from providing any kind of dependent coverage, just going to employee-only coverage, right? Huge co-pays, deductibles, and out-of-pockets are still a thing. It doesn't matter how you get your health care. We limit choice of providers because we get this book that tells us who we can go see and who we can't. Health benefits have to be negotiated, and it requires unions to use their leverage at the bargaining table around this beast that keeps increasing costs, and we never talk about why it costs that much in the first place. We are absolutely seeing wage stagnation due to the fact that we're at the bargaining table trying to scoop up every dollar to try to decrease premium costs and out-of-pocket costs related to healthcare. Next slide. Here's what the impact of wages look like when comparing workers' earnings, the dark blue line, to overall inflation, the light blue line, to the rise in cost of family premiums, the orange line. This alligator's mouth is unsustainable, not only for workers, but for our economy, for businesses, and even for government. The economic cost of this benefit to us as workers, well, between 1999 and 2017, we saw a 213% increase in premiums, which resulted in a 242% increase in worker contributions. How is this something benefiting workers? Next slide. Even for those who, with employer-provided insurance, 200 million claims per year are denied. The reality is the insurance companies are making money, as we all know, by denying care. The high cost of healthcare, retiree benefits being permissive, meaning that the employer doesn't have to negotiate retiree benefits with you. Therefore, it's not a mandatory subject of bargaining, coupled with absurd accounting rules known as GASB and FASB, have converged to put unions between a rock and a hard place when it comes to negotiating, particularly for retiree benefits. This is wreaking havoc for retirees across the country, and corporate advantage plans within Medicare then becomes a tool that is used to divide and conquer us and pit us against one another. We see this playing out big time in New York. For any of you who are following the situation in New York City, where the retirees were just arbitrarily moved into Medicare Advantage plans, and they are fighting that and winning in the courts. Due to some specific language, actually, that's statutory for them. But this is what's happening. They're pitting us against each other. So next slide. What's the solution? So this is the convoluted mess of what we have right now, right? This is what our system looks like at the moment. So we have to begin to build the public health infrastructure so that we can get to an improved and expanded Medicare for all, or whether it's the Colorado, whether it's Minnesota, California, New York, there's numerous states that are also trying to do this. How is any of this good for the working class or for public health for that matter? We do not need this complexity. You can hit the button one more time. We can and must move to this. A streamlined payment system that is publicly financed, privately delivered, and in doing so, workers can halt wage stagnation that's caused by trying to fund a system that has no rhyme or reason in how it is, in fact, funded. So I want to speak to just what the work that we're doing around educating and talking with trade unionists and their leaders on why we should be fighting against the privatization of Medicare in particular via these Medicare Advantage plans. So part of building the system to take on this privatization directly involves the solution for Medicare privatization by leveling the playing field between Advantage plans and traditional Medicare. We take back those overpayments that I mentioned earlier, and we limit traditional Medicare's out-of-pocket costs, and we add pharmacy, dental, hearing, and optical benefits to Medicare. Right? That's what's going to get us. And that's an incremental change that's good for us, because that is, again, putting us on the pathway to where we want to be eventually. Doing so makes better use of taxpayer dollars, and it is also improving traditional Medicare. Next slide. What's the cost of leveling the playing field? When I say we can recapture the billions being skimmed and not going to health care and redirect it to improve and expand traditional Medicare, you can see here that we could do that for $85 billion. And again, remember, we're giving them up to $140 billion. They ain't spending. We just take that money back and reallocate it for actual care. We could add, yeah, no kidding, right? What a thought. We could add pharmacy, health, dental, and optical just at the Medicare Advantage level, which isn't great, by the way, but let's just do apples to apples for starters to show that this is absolutely affordable even within our current system. We can also set a maximum out of pocket of $5,000. That's still pretty hefty, especially for retirees on a fixed income, but it might mean you don't need that gap insurance plan after all, that you could handle that kind of a payment if it happened, so you would only have to have traditional Medicare. So it's a reallocation of funds already being expended and using them for direct care. This is how we level the playing field between corporate Advantage plans and traditional Medicare. We subsidize patient health, not corporate wealth. Many unions and retirees find themselves in the position of having to consider corporate health Advantage HMO plans, which is why it's important to know that what these corporate plans are doing overall in facilitating the complete privatization and depletion of our Medicare program is so important. The Labor campaign has a brand new briefing paper. It's called Medicare Advantage, What Union Leaders Need to Know. It's a comprehensive report that looks at this issue from a labor worker perspective and offers resources and even negotiations guidance when Advantage HMO plans are on the table for union retirees. You can access it at our website, and I'm also happy to email a copy to Elaine, and she can get it to the folks so you all can get a copy of it as well. The Washington, Minnesota, and Maine State AFL-CIO federations, along with a number of individual unions, have passed a level the playing field resolution, which lays out how labor should view the privatization of Medicare and the position we should take to deal with the fraud of overpayments to those Advantage plans and protect our Medicare funds. We hope this resolution, along with our education programs and white paper, will help open up space within the House of Labor to discuss whether or not labor should be, in fact, participating in this privatization of Medicare. So we think they should not. We're hoping to get that resolution on the floor of the National Convention next year. So, other things to be thinking about when it comes to trade unionists. When it comes to single payer, Medicare for all nationally and state-based efforts, key for the labor movement is what we refer to as a just transition. Medicare for all single payer will cost jobs, and as trade unionists, that matters to us, which is why workers need to be front and center in defining a just transition. It makes sense for our movement to get in front of this issue, to set the terms of the debate so it isn't used by our opponents. Paying lip service to job loss with vague promises of job training won't work. We need to advocate as a movement for a robust just transition for impacted workers. It's not just the right thing to do, it's imperative if we want to win, because we will not win without labor. There's no question about that. So the labor campaign is focused on winning a national improved Medicare for all system. However, we support state efforts in implementing a state-based single-payer system as well. Although we don't take positions on state bills, we do offer this guidance, 10 things that should be addressed when considering state single-payer legislation to ensure that labor is at the table and helping draft the state legislation. These 10 things are the most common things that labor will likely be concerned about when looking to move state-based legislation, which is why I'm including it here, and I want to make sure that you all get a copy of it so you are aware of these potential issues. We're not likely to get Medicare for All passed in the next few years, but we can build the pathway that leads us there. If incremental change is necessary to build that pathway, then it's important that we're engaged in designing that pathway to ensure incremental legislation in transitioning us towards single payer, not taking us further away and entrenching the medical industrial complex further into this system, right? Examples of stepping stones for Medicare for All would be taking the transition language in the national legislation and start implementing it now. Why do we have to pass the whole bill to do it? We could start lowering the age of eligibility. We could start adding those benefits. We could start capping out-of-pocket costs. All of those things put us on the trajectory towards Medicare for All. So, final takeaways. In other industrialized nations in the world who provide health care for all their citizens in some way, the unions in those countries have figured out that they can't keep their own health benefits without everyone having health care. Working conditions, child care, elder care benefits, restoration of defined benefit pensions, even wages themselves. There are plenty of terms and conditions of employment that workers in their union have to confront to make the workplace safe, productive, and non-toxic. These are the kinds of issues unions in countries with some kind of universal health care are able to focus on because health care is literally off the table for them. Change is coming to the U.S. healthcare system, so it's imperative that the labor movement be prepared to shape the change to serve our members and all working people. Improved Medicare for All will take healthcare off the bargaining table, allowing us to use our bargaining power to improve wages, pensions, and working conditions. Medicare for All is one way to take back some of the wealth that has been robbed from us. If we're going to make such a massive change in the healthcare system, we need to ensure that the workers in the healthcare system, healthcare administration, and the insurance industry are protected. Medicare for All really is the ultimate act of solidarity. So, it really is time to call the question, is healthcare a benefit or a necessity? Tying healthcare access to employment is a failed strategy, and it makes zero economic or humanitarian sense. Our access to healthcare has become a weapon in the class warfare that we are all engaged in. Trade unionists must work to make healthcare for all politically possible by moving from resolutionary politics to revolutionary politics, from transactional representation to transformational representation. And we do that by building a powerful worker, patient, provider, people-centered campaign, because as the grasshopper in the movie A Bug Life stated, you let one ant stand up to us and they all might stand up to us. Those puny little ants outnumber us 100 to 1. And if they ever figure that out, there goes our way of life. Well, guess what? We figured it out, and there's no better time for us to do away with their way of life and amplify our better way of life. Thank you so much for having me here today.